So not to belabor the point on brucellosis, but I had a question or a statement during the brucellosis is not a curable disease. Okay, it is a treatable disease because what breeders do is treat with antibiotics and veterinarians, and they make the bacteria go away in the bloodstream, but not in the tissues. So the test will look negative, but it's always there to come out later. So just be forewarned that brucellosis is not a curable disease. We do not, especially in breeding animals, recommend any type of treatment because we're never going to be sure when it comes back out of the tissue.
Can you talk just
How much closer can I get unless I kiss him? Okay, and then I have an apology. I talk fast, and that was pointed out. I have ADD, if you haven't figured it out. That's why I don't want to hold this, because it's like... But, so I will try to talk slower this time. Go on. So, can we save them? You know, yes, we can save them, and there's a pathway that we're going to learn on how to save them, because one of the nice things about kittens is that if they are going to try to die on us, they pretty much die in the same way. So if we know that they're dying in the same way, then we're going to try to save them in the same way, because diagnosis in kittens is very, very difficult. We talk about kittens past 4 weeks of age, then we can run tests and we can find things out. But in a 2-day-old kitten, it is very, very difficult, and we have to be aggressive. So with our new understanding of normal, and what's the normal temperature? 97. Excellent. Anybody never not to know that. So with our new understanding, now our goal is to what? We don't want any death loss whatsoever. That is our goal. Okay? So, causes of preventable death. We certainly have hypoxia. We can deal with hypoxia or low oxygen. We can deal with growth retardation. We can deal with aggression bomb. But more importantly, we can deal with hypoglycemia. We're going to learn how to do that the proper way. We're going to deal with dehydration. Dehydration is a big killer of kittens. We're going to deal with hypothermia. And we're certainly going to deal with pathogens, especially bacterial pathogens. So we're going to learn maybe where these pathogens come from and take steps to reduce it. Is that slow enough?
Yeah, it's great.
This is really hard. It's like, ugh. So, spontaneous breathing. When they're newborns, spontaneous breathing and vocalizing within 1 minute correlates with what? High survivability. So that's important observation. Emmanuel had on his slides, and I think Arian had on his slides, we need to observe these kittens. So if we're observing them again, we know what's normal, and again we know what's abnormal. I think Arian talked about this. We're going to vigorously rub with the towel. Want to get intermittent stretching, except for you, where you're going to throw them through the air.
I don't throw them.
I know. I'm teasing you.
I'm not tossing them around the room. We're
I know.
arguing.
I know that.
Yeah.
I know.
Only because they're Persians and
Okay.
they are born with congestion.
Okay. Yes, they are. In club palates once in a while. That was. Remember my second C-section? I didn't get a vote out of the deal either. I should have charged you more. Okay, so we're going to stimulate them by what? Rubbing. I don't recommend you all licking the umbilicus. That's her job. But you certainly can rub there. And we're going to rub in the back region against the grain, not with the grain. That's important. Because all these kittens are what? Hypoxic when they're born. Every one of them. We're going to clear the airways. I promised that I would talk a little bit about clearing the airways. So we want to make sure not only the nasal part is cleared, but also the throat. We need to get that out of there, so basically that stimulates breathing, so we get oxygen. So if we supply oxygen to these tissues, we're going to support the ventilation, so we're going to get more gases going through there, which is good. We're going to support the circulation. Okay, circulation in the kitten is critical. And then we're going to have acid-base stability. And we need to keep these newborn warm. Okay, because when we're going to talk about that temperature of 97, we're going to talk about the critical temperatures that we need to be aware of. And you won't know the temperatures unless we take your temperature. Okay, so we need that thermometer. And if we're going to resuscitate these, I think everybody should know about the acupuncture point. So those of you who do not know about the acupuncture point to stimulate breathing in kittens is right below the nose, it's called the filter, and we need to put a needle all the way to the bone. Okay? And we need to turn that needle. If that needle doesn't touch bone, then we're not getting that acupuncture point. It sounds kind of gross, but it's very effective in stimulating breathing in kittens that aren't. Okay? So, but you need to reach the bone. Now we have a question.
Yeah.
You know, I wasn't going to have any questions, but Emmanuel made me have this.
Where?
Right under the nose.
Yes. Right under the nose. Right here. Right where you have it, right there.
You stick a needle in there until you hit the bone.
Yeah, stick a needle in there till the bone.
And then twist it.
And twist it. Very
And
effective
then take it out. I mean, how long have you been in there?
when they start breathing.
Wow.
Okay, question, is this right on the sagittal midline?
Yes, right on the midline where that crease is.
Okay.
Okay, because if you look at each other, you all have a little crease right there, except for you have a
Until they
mustache.
start breathing.
Until they start breathing. You know, in the past, we always thought we should use drugs, and I don't know what they call it in Mexico and Chile and Canada, but in the United States, we called it Dopram or Resipram, and it's been shown not to be effective, and the reason being is that we are using that drug in kittens that have low oxygen levels in the brain, and if they have low oxygen levels in the brain, then Dopram doesn't work. Dopram can work when we have normal oxygen in the brain, but in kittens that don't, then we're not going to be effective. This has been shown to be much more effective, the acupuncture point, than Dopram. So, easy to do. So, the first week of the neonates,
Sleep and
what percent of the time? How often do they sleep? What percentage of time do they sleep the first week? Okay, 100%. Everybody's going to get it. Very good. Very good. So 70% get 90% of the time that they're sleeping and actually eating. Okay? So how hard is it to examine neonates then? Okay? But what are we looking for while they're sleeping? Twitching. They need to be twitching about 60% of the time, 70% of the time. Am I still doing okay on going slow?
Yep.
I'm like counting in between. So, neonates have very limited response to disease. As your kittens get older, they have responses. They can run fevers. Okay, what else can they do? They can get eye discharge. They can get ear infections. They can get urinary tract infections. We don't see that in neonates. Okay, we basically see neonates that want to die. And our job and our goal is to prevent that from happening. And that's why we're learning about abnormal and normal. So if they have a limited response to disease, then it makes it very difficult to diagnose a specific cause. And I may cause some grief here. I don't think it is our goal when we're trying to save newborn kittens to diagnose. Maybe when they're 6 weeks of age and they're sick, Let's go for a diagnosis. We want to save these. We don't have time for a diagnosis. Okay? But what we do know in these kittens is that most of them die the same way. Okay, I've already mentioned that. We're going to tell you how they die the same way, and then we're going to interact and try to contradict the way that they die. So, important factors are always observation. We need to look at these kittens. We need to observe them. We need to weigh them. We need to make sure they're twitching. And we're going to monitor that weight gain. If we know that 6 kittens were born at 100 grams and one was born at 80 grams, which one are we going to pay more attention to? The 80 gram. That doesn't mean we don't observe the other 6, but we certainly want to pay more attention to the one that was born with 80 grams. So, what are the clinical signs of neonates that are associated with disease? Excessive crying, over 20 minutes. Going slow. Loss of suckling reflex. How do we determine that? Stick your finger after you have washed your hands. Okay? If they're weak, how do we know if they're weak? Well, they're not going up to mom. If they're hypothermic, how do we determine that? Lethargy, restlessness. If they're going to regurgitate milk, that's not normal. If they have a thin abdomen, we're going to observe their abdomen. And if it's thin, we're going to keep an eye on that. And if the kitten has a bloated abdomen, it's very common for these kittens just to get gas in their intestinal tract, their stomach, and we need to help reduce that, or else they can go on to the other problems that we're going to talk about in a minute. So if you want to, how do we get rid of the gas?
I take it out.
You take it out. So you use a stomach tube.
I do.
Okay, that's one way. What other ways can we do it? Well, we certainly can rub their abdomen and see if that works.
Stimulate, let them.
Stimulate them, and if that doesn't work, we can use simethicone. Okay, and simethicone has been used in babies that are colicky. So we use simethicone to relieve the gas in those kittens.
Oh, excuse me, how much do you give?
I give 3 drops to newborn kittens. Okay? If they're separated from litter, then we need to be aware that there may be a problem. And the first thing that I'm going to do if they're separated from the liver is take their temperature. If they're ignored by the queen, if they have diarrhea, and when Aryan talks about diarrhea, I'm sure he's going to talk about the different types of diarrhea in kittens. Because some may be normal as we observe it. So, and the last one is constipation. That's found in 60% of sick kittens. So we need to be aware how to deal with constipation. So what are we going to need in our cattery? A scale. Manuel said that, so we agree on that. Manuel and I always don't agree, but there's one we do. I'm a big believer in incubators. You can pick up a cheap incubator at a hospital supply. They do a wonderful job of saving kittens. Plus or minus pediatric stethoscope. I'm going to be right honest with you, I don't use them very much because I can't hear heart rates very well. I try, but my hearing isn't what it used to be. I want you all to have a thermometer. I think that's essential. And a heat source. I put pen light up there, but a heat source is more important. We can do blood work in kittens, but I tell you what, most of the time we don't have the time. But if we are going to do it, we are going to look for packed cell volume, which is an indicator of anemia or dehydration. Okay, so if it's low, then we're going to be concerned with anemia. And if it's high, we're going to be concerned with dehydration. We can do a complete blood count on a very small amount of blood. We We can also do blood glucoses because, as you know, in most sick kittens, they're hypoglycemic. So we assume, again, we assume in a sick kitten they're hypoglycemic because there are many, many things that cause hypoglycemia in kittens. And we may never, ever know what caused them. So we want to make sure that we're aware that we can deal with that hypoglycemia. And the protein levels in a urinalysis, those are things we can do. They're not done very often in 2-3 day old kittens, but they can be done. So kittens die, as I said, they have a common pathway. Doesn't matter if they have environmental causes of illness, if they have congenital defects, if they have nutritional problems, they died pretty much the same way. And we need to understand that pathway so we can treat these kittens more efficiently. So the first thing we need to do is hypothermia. I keep talking about temperatures. It is critical to know the temperature because if you have a kitten that is normal 97 and now it's 96, is that something to be concerned about? Yes. But are we going to take action at 96? I don't think so. But we're going to recheck that temperature, and now if it's 95, we're going to be very concerned. Very concerned because now it's dropping. And that to me is a time to take action. Because if we have hypothermia, we also have decreased respiration rates. And as we talked earlier in the day, we can measure the respiration rates. All we have to do is look at them. And when their temperatures drop, their immune systems are impaired. Bless you. And then they have decreased heart rates when their temperatures drop. And that's critical because if they have decreased heart rates, how is that going to affect the oxygen? Their oxygen levels are going to go down. Okay? And, very important, below 94, they are basically going to have a GI tract that isn't functioning. So, the statement is, down below, we never, ever, ever feed a hypothermic cat at 94 and below. They aren't able to handle, process that food, and will probably cause more damage because now we're feeding what? The bacteria in the gut. Because bacteria in the gut like the same nutrition as the kitten. So kittens can survive 12 hours without eating. They cannot survive 12 hours without fluids. So when they start to dehydrate after being hypothermic, then we need to take action. Remember that. So earlier on, I was asked about tube feeding. Tube feeding is an excellent way of providing supplemental nutrition to kittens. But we don't want to tube feed a kitten that's below 94. Okay, we want nothing in that stomach because we are feeding that GI tract that's not functioning. What we want to do is be concerned about the next thing. So what are we going to do with hypothermia? We want to bring it up, do we not? Because if we have hypothermia, we have to get that up, but we don't want to bring it up too fast. If we cook these kittens, which we can cook, okay, it's very common to put a heat lamp or a supplemental source of heat on these kittens, and then we take the temperature, and now it's 97, so we quit. But that temperature continues to rise, and all we're doing is cooking the internal organs. Okay? So we want it nice and slow and steady to bring these temperatures up. Okay? It may take anywhere from 2 to 6 hours to bring these temperatures up to normal, but that's what we need to do. In the meantime, I talked about, we assume in every neonate that's not nursing that they're hypoglycemic. Can you run a blood sugar on them? You certainly can. But in many cases, we do not have the time to do that. So we are going to assume they're hypoglycemic because pretty much every kitten that's sick is hypoglycemic. Because what did we talk about earlier? They don't have the fat to draw from, and their liver isn't functioning as properly. So we need to supply. So hypoglycemia is found, and this is my point, with vomiting, diarrhea, infections, and I don't know what that 9 is. We need to check their umbilicus. Okay, did we disinfect that umbilicus properly? We need to make sure that mom doesn't have all kinds of feces over her mammary glands. We need to make sure we're going to find hypoglycemia in just about every case of hypothermia. And obviously, if they're not nursing, it's hypoglycemia. So back to my point, we assume they're hypoglycemic. Because if we err and they're not hypoglycemic, what kind of damage are we going to cause if we give them a little bit of sugar? Nothing. But what do we have to gain if we do?
Everything.
Everything. Thank you.
Just like in human.
Yeah.
First aid 101.
Yeah. So, in the United States, there is, in the breeder community, yeah, I'm going to say this because you said help. So I'm going to be a little bit unprofessional. I have a reputation as being called Dr. Butt.
Oh,
Okay? Because I am a huge believer in giving fluids and medications rectally in kittens and puppies. It is a fast, easy, effective way of giving fluids and medications. I am lousy in a 3-day-old kitten of putting in an IV catheter. I have maybe been successful 2 times in 30 years. That's not good. So I went to the point of that neonatologist and going, I can't do this. And he is the one that recommended starting on rectal. You think about your rectum and your colon, it has an excellent blood supply, pretty much the same as in kittens. So if it has an excellent blood supply, that means it's going to absorb the fluids that we put in. Now, you can give it IV. I can't, but maybe you can. You can give it orally. But remember, we don't want to put anything if that temperature's below 94 into that GI tract. So, then I'm back directly. You can give it under the skin, but it's not a very effective way because there isn't a very good fat supply under there. So there's not a very good blood supply under there. So it's not absorbed very well. So it's very common for us to warm up lactated ringers or whatever, put it under the skin, and 2 hours later, now it's down in the belly. And then you shake the kitten and you can just feel that fluid. It's not absorbed very well. So, I am, again me, a huge believer in rectal medications and rectal fluids. It's worked very well in my practice over the years. So that's why I'm called Dr. Butt, but we're off that. So that says dehydration cannot be determined in neonates. Everybody's going out quick here. Press. Sweet. So that means it's true. So we can determine dehydration. How are we going to do that? Urine?
Urine, yeah.
The urine. Skin is not, the texture of the skin is not reliable because we don't have any fat. Mucous membranes can be used if they're a little clammy looking, but to me that's pretty subjective. But if we look at that urine, which is very easy to get, and it's concentrated, we're going to fluids. Okay? So that's how we determine it. When we talk later on, I'm sure with diarrhea, One of the ways that they'll talk about determining, then maybe we can use skin surgery, not in neonates. So dehydration. Neonates are about 80% fluid. So earlier on I said dehydration is critical to know. We can't save kittens if we don't know or don't address their dehydration, because if they're not suckling and their temperature is dropped, they're going to be dehydrated. It does not take them very long to become dehydrated. They also have poor kidney function. Remember, it takes weeks before that kidney is functioning 100% like adults. I like using lactated ringers, and the reason being is because these kittens need energy. The lactate supplies some of that energy. So again, I put in there fluids can be given intraorally or orally, but I don't recommend it if they're 94 and below. I can't give IV, so you can do it. Orally, we don't like. Again, sub-Q I don't like, because we talked about that. They just basically pile up under the skin. Go back to rectally.
So how do you just put it in a syringe and just shoot it up? Or
Okay,
how?
when I give fluids to a kitten, or recommend giving fluids to a kitten, I first of all warm the temperature up to their normal body temperature about, which is 97, 96. I put it into a syringe. I then take the needle off. I hold the kitten head down, rear end up, and I squirt slowly into the rectum.
And how much?
In a kitten, 100-gram kitten, I normally would probably start giving out 3/4 to 1 cc, and I do that about 4 to 6 times a day until that urine is looking the way that I want it to, and that temperature is back up. When that temperature goes up to 95.5, 96, then we can get that back to tubing or orally, and hopefully they're starting to nurse.
Can you repeat that again, where you said the volume that you gave them?
Okay, well, the first and most critical is we take the needle off,
Right.
and I give about 3/4 to 1 cc, because some's going to come back out
Okay.
Every 475, no.
every 4 to 6 hours, because
Thank you.
until they're back eating, or until that temperature is back up, and then I can feel good about tubing them. People always ask me about the size of the tube that you use. What size do you use? 5. I mean, most people use 5. I use an 8. Okay? Because I'm pretty comfortable with that. But 5, that's probably a good recommendation. So infections. If we have a kitten that is dehydrated, hypothermic, its intestinal tract is no longer working, which means its immune system is compromised, we have to be concerned about what's called translocation of bacteria or infections. Because all of you have seen kittens that have either green, blue, or purple bellies, okay? And in many cases, that's peritonitis after the GI tract is stopped. So we want to basically make sure that the bacteria are under control. So we want to wash our hands, because diseases are often transferred from cat to humans to cats. Same way with brucellosis. I'll go back to that. It is very common for a person to deal with a sick dog that has brucellosis and transfer it to another dog. And there are many, many other diseases that we can talk about that's the way. So washing your hands is never a bad idea. In fact, if I have a sick pup or kitten, I always put gloves on. There are some antibiotics that you do not want to use. Okay, why is that? What did we talk about? We talked about the liver's not functioning properly. We talked about the kidney is not functioning properly. And we're talking about a kitten that's 80% water that may now be 60% water. So there are very few antibiotics on the market that are safe and effective for kittens and puppies. So beware. Maybe I'll make a habit of going slow.
Yeah, this
It's good.
That's a Vaseline.
Vaseline. The one I didn't put up there is called Ceftofur. That's C-E-F-T-I-F-U-R.
And those are good choices?
Those are very good choices. And they can be given rectally. They can be given IM, which is probably not a good way to give it because they don't have a great blood supply. And again, they can be given sub-Q, but again, they're not absorbed very well. But those are very safe and effective. And what do we mean by safe and effective in a kitten? We are not going to damage their liver any more than it is, and we're not going to damage their kidneys any more than it is. Because the liver and the kidneys play a role in many of these drugs that we give kittens, and we can basically wipe them out by improper use of that.
Can you, the Clavamox, liquid Clavamox, can you do that rectally too?
I have. That's why I'm called Dr. Button.
So what would the dosage be? Because I.
On Cepaxilin and...
No, the Clavamox, yeah.
Okay, well, normally it's 1 cc per 10 pounds, so then we get a tenth per pound. So basically, I dilute it in half and give them a half of a pound.
So I've always, I've never done directly, but I'm willing to try. But I've done what you talked about, the purple belly syndrome.
Yes.
And I jump on it right away.
Yes.
And I do 1 drop of Clavamox every 12
So
hours.
0.01 mil.
I don't know what it is, but you
Well, if
have
you
to
give
measure
it-
a drop. I mean, it could
Well, that's
be-
probably in the same range.
Yeah.
I mean, I can't tell you for sure, but it's probably in the same range.
Yeah, and it works.
Anything that works, because that's our goal, is to reduce mortality.
You didn't know whether or not.
That's right. But if you see a kitten by the time it has a green or purple belly, and you're saving them, then you're doing a good
Well, you
job.
know what's also first sign? They'll act like a colicky baby. They don't want to nurse. And that's a first clue. You got something going. And then I'll
Okay.
check the color and go jump on it.
Well, the statement is, because I'm supposed to repeat the statements, the statement is that if they're act like a colicky baby and jumping around and moving around abnormally, that's her first sign. But remember, going back to that list, that 60% of sick kittens are constipated. And a constipated kitten is a colicky kitten. Okay, so just beware of that also.
So that's easy to remedy rectally.
Yes, it
with
is.
Just a little bit of
The
saline.
the statement is that constipation is easy to remedy. But if you're giving IV fluids, you've got 2 birds with 1 stone there. You're loosening up that constipation, but you're also giving some fluids.
Constipation, you get that with, and I give a couple of prune juice, just a couple of drops, and it works. You don't have to go.
So the statement is prune juice. I can't respond to that, I don't know.
It works.
I've never used prune juice, but we have a statement here that she swears by it works.
But a 2-day-old kitten?
I give just a couple of drops, and it worked. So, you know, you don't have to go all medical all the time.
And you can use homeopathic pills.
Yeah, sometimes, you know, good old
Just
fashioned.
before going with the big war, just try soft war,
Yeah, sometimes it works.
maybe. Okay.
No, I'm with you.
Prune juice, you know, it works.
I mean, basically, it comes down to everybody here that's a breeder has their tried and true methods. My job isn't to change that. My job is just to tell you basically how kittens die
Yep.
and what steps we can do. So if you have something that works, I'm not going to try to talk you out of
We
it.
were Butt.
Yes.
We were Butt breeder. You're Dr. Butt, we are breeder Butt.
Okay. I don't want to tell you what they said. So You can just not translate. Okay.
No, I give it orally, you know, but.
So if kittens do not get the colostrum, and what are we concerned about when we eat colostrum? How many hours?
You know, sometimes.
24. Well, we know now probably 18 is probably 5 minutes. Okay, I'm just about there. 18 is probably the ideal. Okay, so after 24 hours, the amount of immunoglobulins are really reduced. Not only in her milk, but being transferred in there. So let's go with 18. So if they get insufficient, we can use a serum from a compatible pack. And that's how we do it, and that's what we do. So I only have a few minutes, so I have to move on here. So more kittens die from improper nutrition and lack of husbandry, sound husbandry. So what do we mean by husbandry? We mean environmental temperatures. We mean humidity control, okay, because humidity control contributes to death in kittens, okay? We need to be aware that we clean and disinfect properly, because a clean cattery in a clean area is not a disinfected one, but a disinfected one is a clean one. We need to make sure that the queen is clean and that we are clean, okay? That we don't overwhelm the immune system. So going back to this, I thought there was another question. Okay, going back to this, how do we save them? We need to make sure they're not dropping hypothermic. We don't want them below 94, so beware. If they're below 94, we need to make sure, because we're aware that dehydrated, so we want to replace fluids. And remember that kittens can go 12 hours without eating, but not 12 hours without fluids. We know that just about every sick kitten is hypoglycemic. You need to replace that sugar somehow. We basically, if we can, if you have an incubator, if we give oxygen, that is an excellent way of keeping the kitten's body and lungs healthy, and also that heart rate up. Because we also said when the temperatures drop, that heart rate drops. And we want to use, if we do use antibiotics, we want to use the proper ones. And that's how we save kittens. And that's how we drop the mortality rate from 20 to 25% down below 10, and even sometimes around 5 to 6%. A lot of these things you can just do it yourself, because you don't have time to rush them to a veterinarian. If you do get to a veterinarian, I would make sure that they have an incubator, because every kitten that I've ever, and every puppy that I've ever done a C-section on goes right into an incubator. Because we know if we don't do a proper job of a C-section and we don't get them properly, then we are going to have compromised kittens. So if we're going to do a C-section, we want to make sure that we use safe anesthesia. We want to make sure that we pre-oxygenate the mom, okay? Because we're using anesthesia for her. It also helps maintain basically blood pressure, which is critical for those kittens. And we want to use IV fluids, okay? Because you've all been present at C-sections. You know how much fluid is lost. So fluids will also help maintain her blood pressure, her acid-base status, and keep those puppies as healthy as possible. And the other thing that we really want to do is control pain. If we control pain in her, then basically those kittens come out healthier. So, if there's no questions, I thank you, and we'll move on, because